Okay, so what's interesting is when we look at patients presenting to GP practices, it's probably about 80% of them don't have what we call defined pathology, which means there's no active disease process going on. I think also what's interesting is in the current economic climate, where we spend about £120 billion a year on healthcare, it seems to be that perhaps a large proportion of those patients perhaps are not getting the best care that they actually need. We have a saying at the health equation, everything is about something else. And I'm always amazed when a patient comes in with their particular crisis. As you gently delve into their history and their complaint, there's a lot of other stuff going on, sometimes actually much more important than the initial patient presentation. I'll give you an interesting example. We know about 30% of patients who present to accident and emergency hospitals in America with chest pain are found not to have any significant cardiac or respiratory disease. Now, at the time, the patient probably thinks they are having a heart attack, and that's what's driving a lot of their anxiety. And actually, when we explore many of those patients, either the cause of their symptom tends to be muscular, or significantly, it has an anxiety component, of which possibly something like over-breathing is one of the problems. Over-breathing is a particular problem endemic, I think, to Western societies now. When I look at many of the patients that come to see me at the health equation, I estimate at least 70% of them aren't breathing properly. So I know that sounds really strange, but you've got to remember that breathing is a subconscious activity. Now that means for most of us, we actually don't think about breathing unless we have an obvious problem. When we have a cough or a cold, asthma, some of the other lung conditions, we become much more aware of what and how we're breathing. Now what's interesting, breathing of course is fundamental to life. The reason we breathe is to get oxygen into our system on a cellular level. Cells, whether they're brain cells or muscle cells or heart cells or liver cells, they essentially need oxygen from respiration and things like glucose and other nutrients from diet. Ironically, getting in oxygen depends on an adequate level of carbon dioxide. So one of the ways we explore people's breathing behaviour is with a very special bit of kit called a CatNa Meter. It's a non-invasive way of looking at people's breathing behaviour, and this works very well with a heart rate monitor. So what I do is I connect the patient via a nasal cannula, so they wear a little tube around their nose. That's connected to a bit of hardware, which then connects to my computer. And hey presto, on the screen, for the first time, the patient can look at their breathing behaviour. We can measure their levels of carbon dioxide, we can measure their breathing rate, we can measure their heart rate, and very importantly, we can measure something called heart rate variability. Now what a lot of people don't know is when you breathe in, your heart rate goes up, because that's what we call a stress or sympathetic nervous system response. When you breathe out, your heart rate goes down, and that's called a relaxation or parasympathetic nervous system response. And what's interesting from a health perspective, having a high heart rate variability, which is the difference between your heart rate when you're breathing in and your heart rate when you're breathing out, is a very good indicator of health. So for example, what a lot of people don't know is when you breathe in, your heart rate goes up, and when you breathe out, your heart rate goes down. Breathing in is a stress or sympathetic nervous system response, and breathing out is a relaxation or parasympathetic nervous system response. The measurement of heart rate variability, which is a number, is really the difference between your heart rate when you breathe in and your heart rate when you breathe out. If I had a look at one of my elite athletes who has a fantastic neuromusculoskeletal system, fantastic nutrition, and is actually pretty chilled out, they'll have a heart rate variability of about 30. My average office worker has a heart rate variability of about 4 or 5. So how would I advise a patient? I think for most of us the first thing would be to just simply slow your breathing down. The easy way of doing that is at the end of gently breathing in, you would simply pause. You would then breathe all the way out, and at the end of breathing out, again simply pause. And before you know it, you've probably decreased your breathing rate. The second thing is be aware of where you're breathing from. Most of us have a habit of breathing very much from our upper chest. In fact, what we want to be doing is using our diaphragm, the big muscle of breathing at the lower part of the rib cage. So when you breathe in, what should happen is the belly comes out, and as you breathe out, the belly drops back down again. So essentially for most of us, we overbreathe with our upper chest. So when we breathe in, we think what we should be doing is, in fact, what we should be doing is trying to use our diaphragm. The diaphragm is the big muscle of breathing at the lower part of the rib cage. It's a dome-shaped muscle, and when we breathe in, what should happen, the diaphragm descends, and as it descends, it gently pushes our abdomen out. And as we breathe out, the opposite happens. We just very gently allow the abdomen to let go, a little contraction of the lower part of the rib cage, and air comes out. This is an example of upper chest breathing, which is what most of us do. And so if I now move my focus of attention to using the diaphragm and the belly, and again the diaphragm and the belly, the other critical factor is the relationship between breathing in and breathing out. For most of us, because we're always focused on getting this oxygen in, we think that breathing in deeply is a good way of doing it. Ironically, we want to breathe gently, so deeply is not helpful. And the other important thing is concentrating on a very long, slow out breath is a very good way of retaining CO2 within the body.